I am Andre, your site nurse for the day, and I am here to perform and demonstrate the evaluation checklist for ear assessment. The first thing we need to do is we need to introduce ourselves, verify our client's identity, explain to the client what we're going to do, why it is necessary, and how the client can cooperate. Good day, ma'am. I am Andre, your science student nurse for the day, and I am here to do your ear assessment. But before that, may I know your name, please?
I'm Mariela May Suarez,
How about your age, please?
18 years old.
Ma'am, ear assessment is necessary to verify if there is any problem or if there is any variation from normal findings on your ear.
Okay po.
Ma'am, please cooperate with me during the assessment.
Okay.
Thank you, ma'am. After that, I am now going to perform my hand hygiene and observe for other appropriate infection control procedure. Performing the hand hygiene is to prevent for any spread of any infection. After that, I am now going to assemble all my equipment and supplies. So I have here pair of clean gloves, ruler, the tuning fork, watch with hands, and of course a otoscope or pen light. We need to provide for our client's privacy also by drawing the curtain and closing the door in the room. Let's now determine the client history of the following, like classical symptoms of ear diseases like deafness, tinnitus, discharge or otorrhea, pain or otalgia, and vertigo. Ma'am, like nung mga nakaraang araw po ba, ma'am, nagkaroon na po ba kayo or naramdaman niyo po ba sumasakit po yung tenga nyo? Or kumikulit po yung tenga nyo?
Hindi po.
Ma'am, how about naranasan niyo po bang nahihirapan po kayo makarinig?
Hindi po.
Ma'am, how about any history of family deafness? Like, baka may part po kayong pamilya na bingi po.
Wala po.
Ma'am, how about any previous ear surgery or head injury po? Like, na-aksidente po kayo, so kailangan niyo pong magpa-ear surgery, gano'n?
Wala po.
Ma'am, how about any systematic related diseases po like stroke or cardiovascular diseases? Ma'am, kasi ma'am, for instances, there are diseases na maaaring maapektuhan po yung ating sense of hearing.
Hindi po.
Ma'am, how about any cytotoxin drugs like nag-intake po ba kayo ng antibiotics like gentamicin or cytotoxin? Ma'am, because may mga gamot po kasi na maaaring feel po natin is nabibingi po tayo kapag iniinom po natin yung mga gamot na yun.
Hindi po.
Ma'am, how about any na-expose po ba kayo into noise like meron po yung shooting or may mga ginagawa po yung kalsada sa tapat ng bahay nyo or ginagawa po yung bahay nyo kaya na-expose po sa mga maingay na places?
Sometimes.
Ma'am, how about yung history of atrophy and allergy to child?
Hindi po.
Thank you, ma'am. Let's now inspect the external ear of our client for shape and size, position, and presence of lesion and discoloration. The ears must be equal in size, similar in appearance. The alignment of the pinna should be with the corner of the eye. And in vertical position, the angle must be 10%. There must be no presence of any lesion like nodules. The ear must be smooth and it should be color pink. Let us now palpate the external ear. Palpate the ear, the tragus, the mastoid, full the helix. There must be no tender auricle and tragus. Palpate for the mastoid process for tenderness, temperature, and edema. Masakit po ba?
Hindi po.
There should be no tenderness. There should be no pain when being palpate. The temperature, it should be warm. It should be moist and easy to palpate. It means that there is no presence of edema. For the audiotar canal, using our pen light or otoscope, we're going to inspect for discernment, appearance, and tenderness. For the color, it should be black, dark red, gray, or brown. For the consistency, it should be wacky, flaky, soft, or hard. For the odor, it must has no odor. For the auditory canal wall, it should be pink. It should has a visible tympanic membrane. When manipulating the pinna, it should be no or little discomfort. For the inner two-third, it should be very tender when being touched by the speculum. Let us now inspect for the tympanic membrane using our otoscope or pen light. We're going to inspect for the color, consistency, and landmark. Ma'am, please swallow. Lumunok po kayo. Thank you, ma'am. For the color, it should be a pearl gray, shiny, and translucent. For the consistency, it should be intact, may show movement when swallowing. For the landmarks, it should be a cone of light, umbo, translucent, and short process of translucent is visualized. We're now going to assess the client's auditory function using a clock, and by whispering a sentence that the client was able to repeat. We're going to stand 1 to 2 feet away from our client, and we're going to ask the client to cover her one ear. Ma'am, please cover her one ear. Any penny is a red hen.
Any penny is a red hen.
We're now going to assess again the client's auditory function using a clock with hand. We're going to place the clock with hand 1 to 2 inches away from the client. We're going to ask the client to cover her one ear, and the client was able to hear the tick-tock of the clock. Ma'am, please cover your left ear. Ma'am, are you able to hear the tick-tock of the clock?
Yes.
Ma'am, how about your, please cover your other ear. Ma'am, are you able to hear the tick-tock of the clock?
Yes.
We're now going to assess the client's laceration of sounds. So we're going to use a tuning fork in this assessment. The first thing we need to do is we need to use the Weber's test. We're going to place a tuning fork on the middle part of the client's head. Ma'am, do you hear any vibration?
Yes.
On your left ear?
Yes.
On your right ear?
Yes.
The client was able to hear the vibration on her both ear. We're now going to do the rings test. It is the comparison of the air conduction and bone conduction. We're going to place the tuning fork on the muscle part of our client. Before moving the tuning fork, we need to make sure that the client will not hear any vibration. Ma'am, do you hear any vibration?
Wala po.
How about now?
Meron po.
The air conduction is twice as long as the bone conduction. We're now going to perform the Rumber's test for the equilibrium. We're going to ask the client to place her feet together, arm on the side, and keep her eyes open. Ma'am, please place your feet together, arm on your side, and keep your eyes open. We're going to place our hands on the client's side to prevent from falling. With the same process, but now we're going to ask the client to close her eye. Ma'am, please close your eye or your eyes. You can relax yourself now, ma'am. We need to take note for the minimal swaying while the client is still standing straight. And now we're going to document all our findings.